Hello, 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 my friend.
Hey, friend, what's up, boo?
I am so excited to have you as my co host today, and I cannot wait to introduce you to our audience. So, I'm thinking we should do the official introduction and then do some chit chat. Does that work?
I'm with it. Let's go.
All right, let's go. Hi, y'all. I am Christine Gautreaux, a white social justice advocate, an international speaker, coach, best selling author and publisher, and a dancing social worker who helps you upgrade your self and community care.
What's up, y'all? My name is SatiMa Ra. I'm a Gen X cusper who believes fun is the fitness and appreciates life in all capacity. I'm your friendly vibe architect, bringing the good juju.
And also the behind the scenes magic of Women Connected in Wisdom podcast. Together, we are a podcast rooted in the 8 dimensions of wellness. And we like to get together every week for intentional conversations about how to be wise in business, relationships, and wellness. How do we do this?
How do we do it? We do the do.
I am so excited you're here, my friend. When we were having this conversation and we were like, you've never co hosted in
No.
229 episodes. And y'all, when I say she's the magic behind Women Connected Wisdom, when we call out Sati's name, like this is who we're talking about. She makes sure we sound good. She does the post production. She does all that jazz.
Oh, it's been an honor. It's kind of crazy to think it's been, 5 years, 229 episodes and counting. Well
Right?
done. Well done.
Well done,
Hallelujah.
you.
All but
So,
women connected. That's what we
right?
do in
So,
wisdom.
how are you, friend? How's your week going?
Being well, being well. Started a new gig, so adjusting to that, dealing with this Atlanta heat, bruh. It's insane in the membrane.
Right,
Maybe
it
we'll
really
talk
is. The
about that too.
mugginess,
Mhm. Some
where
hormones.
Hotlanta is has shown up for the summer. It is true.
Like overnight, huh? It went but I'm with
Right?
it. I'm, grateful. Actually, always thinking of Shannon because that's when you check in with her. She was always like grateful. And
Yep.
yeah, as I listen on behind the scenes, I was like, you know what? Yes, grateful, grateful,
Right?
thankful, blessed. That's
Right?
underneath it all. Present.
Heck yeah. I spent the weekend in Jacksonville, Florida,
Oh, yeah.
and starting 3 days with my feet in the Atlantic Ocean and watching the
Mm.
sunrise, and it's like nothing better, right? During the
Yeah.
summer. There's some years I go and I confess I'm too busy, like to go to the beach or things like that. And this year things just aligned and we had a long weekend and I was like, everybody was like, beach, because we hadn't been in 5 years to
Oh.
as a family. Like
Oh,
I've been
okay.
to the beach in between, but not like a family trip. And have you
Mm.
been down to Amelia Island and Fort Clinch? Have you been down to that area?
Mm-mm.
Oh, highly recommend. It's
Mm.
super fun. It's super fun, and we just looking for shark teeth and checking out the animals. We had several tortoise sightings and Florida is like the bird watching capital. I didn't realize that, but my oldest, Alex, is a bird watcher. And
Okay.
I got to see, now this, y'all, it makes me sound like an old lady, but it's so cool. We got to see a rosette spoonbill, the pink ones with the big funky bills. Have you ever,
Mm.
like, you know what I'm talking about?
No, but I got
It
Google.
it was so cool. I was like, and they kind of open their mouth and they kind of do this scooping thing. It was hysterical, but
Oh, wow.
it was a lot of fun. We had a really good time.
Oh, that's awesome. That's
Yep.
awesome. I'm glad y'all were able to do that as a family. I did get to go into the Atlantic a few weeks ago. I went to St. Thomas for my great niece's graduation, high
That's
school.
right. Shout out her name. Congrats.
Harley! Shout out to Harley! Woo!
Harley, congrats on your
Woo, woo, woo.
graduation, babe. Good
Yes, yes,
job.
that was awesome. So it was a tight time there, but we did make a day to go to the beach and we did snorkeling. My niece
Mm.
had extra snorkel gear, so just all the critters just underneath the ocean, just like right at your feet. You don't even have to go that far in. It's
Are you
amazing.
good at snorkeling?
Yeah, I mean,
Okay. I know that's a weird question,
Loaded.
but I always try to drown myself when I'm snoring. I'm not like when
Oh,
between my ADD and my left right brain hemisphere, whatever, because I'm left-handed, and I'll breathe in when I'm supposed to be breathing out. Like I'm okay to snorkel if the snorkel is above the water, but if I'm supposed to be doing that, blow your snorkel out, it's not my superpower.
well, I'm a lefty too, and yeah, we ingested a little bit of salt water, but I found myself being rather buoyant. I don't know if it's a
Okay.
big booty happening, like just I'm going. I was trying to dive down, but it was just like I was like, is anyone else having this issue?
You need the weight belt on, right? When I took scuba diving, like you often needed the weight belt. Well, I love that.
Yeah,
Well, all right, friend, you want to kick off the show and
yeah,
let's get
let's
our
do
guest up
it.
here
So
and let's have
excited.
I'm so excited to have this show.
Mhm.
So today we're talking about physical wellness. You want to define it for our listeners?
Absolutely, it'd be my pleasure. So, the Women Connected in Wisdom definition of physical wellness. Physical wellness is the ability to maintain a quality of life that allows you to thrive in your daily activities without undue fatigue or physical stress. Physical wellness recognizes that our daily choices, habits, and behaviors have an impact on our overall health, well being, and quality of life.
Right? Our guest today is going to speak perfectly to this. I just
Mhm.
can't wait. I'm going to go ahead and give her bio and get her up on stage because I have so many questions.
Let's go.
Today, y'all, we are joined by Dr. Aleksandra Gajer, originally from Poland and raised in the United States. She is a dedicated medical professional focused on advancing healthcare. She graduated with top honors from the University of Maryland School of Medicine and completed her residency in academic emergency medicine at the George Washington University. So, y'all, we got a doctor in the house. Come
Mhm.
on up here. Hello, Dr.
Hey, hey. Hi, guys. So
Welcome,
excited to be
welcome.
here.
We
Thank
are
you.
so glad you're here. Now, you are zooming in today from Northern Virginia. First of all, we got
Yes.
to do the Southern thing. So, how's the weather?
Oh, it's awful. It's awful. It's way too hot. I have to say, it's probably way hotter for you guys, so I shouldn't be
It's
complaining,
okay.
Okay.
It's
um,
all relative.
but it's rough out there.
Hmm.
The struggle
Well,
is
and the
real.
thing about the South, y'all, is it's not just the heat, it's the bugs. Because when the
Yeah.
heat comes out, we got critters everywhere.
Yeah.
That's the part about summer. I love being outdoors, but when it starts to get that buggy, I'm like, come on now. So,
They're a little
well,
aggressive too. Sorry, they're
they
just like
are.
flying in my
No.
face, and I almost
Yeah.
ate one. I was like, "What? We don't need to be that close."
Right? We don't need that extra protein.
Yeah, unless if it's good
So,
for my hormones.
absolutely, we're about to have that
Yeah.
discussion, right? So, today we're talking about functional medicine. So, Dr. Geyer, the first thing I want to ask is what is functional medicine? Like, if somebody
Yeah.
looks at that title and says, "What do you mean?"
Right. Great question. So, conventional medicine focuses a lot on disease and how we fix diseases once people have a disease or an illness or an injury, whereas functional medicine focuses more on how the body is working, how we're creating a state of health, and what the root cause is potentially if somebody does have symptoms or an illness. But it is less disease focused and more focused, in my opinion, on creating health.
Oh, I love that. So,
Yeah.
say I'm just hearing this for the first time and I'm like, how do I find a functional medicine doctor? Like, what do I look up? Do you
Yeah,
just say functional medicine doctor?
you can. You can
Okay.
absolutely look up functional medicine doctors, and I think that it's something that um, people are becoming more interested in. I think I was trained in conventional medicine. Like you said, I did emergency medicine for 10 years. I did the prescription writing and the procedures and all the things. But especially since COVID, I think people are much more interested in sort of becoming healthy and living in bodies that are really vital. And I think conventional medicine has bought us like an extra 50 years of life. Until like 150 years ago, we all lived till 40. Average life expectancy was like 40 or 45. So we've done this miraculous thing with modern research and medicine where now we're living towards to 80, 85. But now people want to know, how do I feel good during those years?
Mhm.
Like, thank you very much, but like, I want to have energy. I want to sleep well. I want to do all these things with my life. How do I live in a body that allows me to do that? And that's the question that I try to answer and help people with.
I love that. One of our Women Connected in Wisdom authors, Dr. Sheila K. Collins, turns 87 this year, and she
Woohoo.
can outdance me. She can like she is incredible. And so when you said that about being healthy and being, I'm like that right there. Sati, you got any questions?
Well, just sort of an add-on with I teach in a form of African dance fitness called Kukua, named after the founder, and she's in her mid 60s, and she can outdance the world. Her energy is so on point.
Yeah.
So that reclamation of energy to be able to do what we want and have that fulfilling life, I think is so important. So I'm really excited that you're bringing that to the table today.
Yeah. And I love that you all are talking about movement, because I think that is really like such a key in all of this, and the women who are dancing at 87, they were moving their bodies at 67. And I think that what we do about 20 years earlier is kind of writing the blueprint of how we're going to be at an older age. And I think a lot of people, both men and women, will sometimes slowly give up on activity, where you're too tired or it's inconvenient and you don't understand how much you're giving up, and that you don't get that back. And when people start to forfeit little bits of their mobility, their activity, and give more time to the sofa, we're actually, we're doing a disservice to that version of you 20 years down the road that wants to dance. So
Mhm.
movement
I
is so
love
key.
that. Okay, so and I know you can't answer this for everybody, but what do you recommend for folks? Because the everything you hear different things, and if you're paying attention to the internet, who knows what message you're getting. But for the average, our listeners go from age 25 to 87 and beyond. So
Yeah.
for the average person, how much exercise should we be getting a week? How much movement?
Yeah, that's a great question. And I think for me, and I think this kind of taps into what you all were saying too, I think that doing something that brings you joy is the most important part. That not the same form of exercise is not going to work for every person. I think just walking and making sure that you're active in that way is really important. So if you can be walking every day, if you're looking at your steps, and we all hear about the 10,000 steps, that's great. Not everybody has the capacity to do that. But if you have a step tracker and you just wear it for a week and you see what's my average number of steps that I do in my regular life, and then next week try to increase your average by 1,000 steps. And that's not so hard, because that's like an extra 10 minutes of activity. And you can do that. That's much more manageable than saying I need to take a 45-minute walk twice a day, which is not accessible to everybody. But I think walking is so healthy. When you go to the grocery store, just park a little further, take the furthest spot, even things like that makes such a huge difference that we kind of underestimate. Of course, I think strength training is fantastic. As modern medical research is advancing now, we know that muscle is really the currency of health. Having lean, healthy muscle. There's a study that I like to talk about that looked at what is the number one factor that will predict if someone survives a cancer diagnosis. And they looked at their diet, all these other things. And the number one predictor was how much healthy muscle did that person have going into the diagnosis. And the people with a large amount of healthy muscle were far more likely to survive cancer. So I think,
Wow.
yeah, so that's resistance training, strength training, but even walking builds muscle. It's just kind of I think we've been kind of brainwashed, especially in the 90s, about this sort of like move more, eat less, to kind of stay thin. But I really try to empower both men and women. We want you to get bigger. We want you to build up, get that healthy muscle, because that's going to carry you through all the decades of your life.
Oh, I love that. Do you remember where that study was from?
I'd have to pull it up, and I don't remember right now. but
Okay. If
I'll
you
look
pull
for
it
you.
up, will you send it to us and we'll tag it in the show
Absolutely.
notes? So
Yeah.
folks, we like to give our sources, but I
Yeah.
love that is powerful.
Yeah.
When you think about that we have the power to make a difference in that, even with something as
Yes.
scary as cancer.
Absolutely. And I think a lot of people, we think, gosh, I hope I don't end up disabled or in a wheelchair or having to use a walker, but we don't realize how much of that is in our control, and we naturally lose about 3% of our muscle every decade. And if we do some strength training, if we are active, if we're eating enough protein, we can prevent that. And you can really, and it's never too late. You said your age group is from 25 to 87. You can start at 87. And at 87, it may be just getting up from the chair and walking around the sofa. But then the next week, you're going to walk around the sofa twice. And that's awesome. We know that you can still gain function at any age, and it's never too late to move your body.
I love that. I've got two things, and so the first is protein, because I'm always telling my friends, eat more protein.
Hmm.
So how do you factor how much protein you're supposed to have
Yeah, and this is like everywhere. I don't know if you guys have
everywhere?
seen those memes
Oh,
where
yes.
it's like I have more peer pressure to eat protein in my 40s than I did
Right.
to have drugs as a teen.
Right.
Um, yes. So if you're alive and over the age of 40, you've probably heard about protein.
Yep.
Um,
Everywhere.
Yeah, but it is really important, and it's again the crucial macronutrient for building muscle. And I think it varies for what you need based on your size, your height, your level of activity. But I think what's more important is that you eat protein at each meal throughout the day, and your body has some protein throughout the day. And if you try to have about 30 grams per meal, then you usually are doing pretty well. So that's probably lower than some people talk about, but people are setting what I think are crazy protein targets that make it
Mhm.
impossible unless you quit your job and just count protein for a
Right.
living. And I think that's unrealistic. I think we should be eating protein, but it's got to fit into your life. And like you can easily get 30 grams of protein out of a chicken breast.
Okay.
Or if you combine Greek yogurt, some eggs, put some extra egg whites in there, you
What do
can
you
get
feel about the cottage cheese? I know. I've got a doctor on tap, Sati. I'm sorry, interrupt me if you have a question, but I'm
I
like,
feel like
oh, when I see these things on the internet, I'm always like, I have a question about that, and I haven't had a chance to research it. But the other
yeah,
fad is putting cottage cheese in everything to boost your
yeah,
protein. So, but
totally, it
okay.
works.
Okay, great. All right, I
Yeah.
have one more thing and then I'm going to toss it to you, Sadi. So the other thing is, have you seen the trend that's going on? And maybe it's just my feed because I need to do it, but where you get up and down off the floor without touching the floor?
Yes. And
What do you
I think that's amazing and very, very good. And again, that's about the mobility. And I think
Okay.
it points to that we don't realize what we're losing until we can't do it. As a kid, every kid can do that. They're like
Right.
jumping from one position to another, but you don't remember the day that you stop doing that and that you start leaning on other things. And so consciously, seeing if you can do things like that kind of functional mobility is so important. It will also just, the weight bearing exercise, preventing osteoporosis, making sure that hip fractures are such a important cause of decline and frailty, that those kinds of functional movements are really important.
Mm. Thank you for answering these like random.
Yeah,
I've been having this in my brain. I need to ask somebody a question.
they're good questions.
No, they are great questions, and they got me thinking about some things too. So I was curious. Well, on that last note, the body gives us signs too, right? Like, so clocking when you start, when you go to sit down and you start making those noises, like, I just hear that and I'm like, oh no, that's being aware of that. That's sort of an indicator, like maybe I need a little more movement. Otherwise, my body wouldn't be trying to tell me every time I sit down or do something. So I thought that was like a good like little resource to share. But I'm curious about the protein because it is everywhere. Everything is protein enhanced. Like even my Publix coupon apps like has a section for protein. I was like, but these are all things that are supplemented protein. It's not necessarily what I would think is like so immediately bioavailable or bioabsorbent. I don't know if I'm saying that correctly. Do you have any thoughts about that, about where we should be sourcing our protein from?
For sure. I mean, I think the more you can get from whole food sources, the better off you are. And I think that goes for everything, not just protein. In the last several decades, we've seen a huge explosion in autoimmunity or inflammation and autoimmune conditions like thyroid illness and arthritis and all these other things. And a lot of that is because of the non-food chemicals that we're putting into our body. And, so whole foods are always the best source of protein and nutrients. And if anybody just wants to make one change, that'll make them healthier. And what we mean by whole foods is something that doesn't need an ingredient list or has an ingredient list of just a few things and you know what they are. You can explain what each one of those things is. Once the ingredient list gets like 10 items or more and you can't pronounce them, that's no longer a whole food. The other thing is that those engineered foods are the food science industry has really advanced, and they've taken a lot of notes from the cigarette industry. They found something called the bliss point, which is that point where you get a salt and sugar ratio and a crunchiness ratio to exactly the right point where it stimulates this bliss point in your body. And you start to have physiologic cravings where you can't stop eating it. And, so many Americans are dealing with being overweight. I think, and unfairly, a lot of people feel like it's their fault, when really what we don't realize is that a lot of the food that's the most available is engineered to make us unable to stop, to hijack our bodies to have those cravings. And I always tell people, it's really hard to sit down and eat 6 apples in a row. But if you wanted that sugar carb load out of like a bag of chips, super easy, just because they're like hyper consumable. So with whole foods, it's just much harder to overeat. People aren't going to eat like 6 bags of carrots or 12 peaches in a row. It just doesn't happen.
I love you saying that. I'm currently doing the Whole30 for a reset. So for folks that don't know, like the Whole30 is 30 days where you eliminate sugar, you eliminate any processed food. And I have done it in the past and my body loves it, loves it. So I know the results. I sleep better. I have more energy. But in all fairness, it's a pain in the butt because I got to cook everything and I got to clean. And so that's the other thing about for modern women, especially like if we're having to work full time and cook and clean 3, like it's a lot. And so
it's a lot.
It's a lot, but my body is so happy. Like just like, thank you, thank you, thank you.
Yeah, absolutely. I've done the Whole30 a bunch of times too. And I also love it. And it's hard. It's really hard.
Well, those first 3 days when you get off sugar is like, don't talk to me. It really kind of is like menopause. I know pre-show we were talking about hormones. We were talking about peptides. So we've got to ask those questions because I don't want to run out. If we run out of time and don't know what a peptide is, it's on us. So let's do a easeful transition. Let's say, all right, Dr. Gajer, what are peptides? Why are they all over the internet? And what do we need to know about them?
Absolutely. Okay. So we know, like we talked about earlier, until about 150 years ago, most humans lived till age 40, 45. That was the average, our life expectancy. And that was the case for like over 100,000 years. So we have these genes that adapted to a lifespan of 45. and but over a really long period of time. And so there are these peptides inside our bodies that are chemical messengers. So I think the word peptide is a little bit misleading because in science, all peptide means is a short chain of amino acids. And those are just, and if you have more than 50 amino acids in a row, then it becomes a protein. If it's less, then it's a peptide. So it just tells you about the chemical structure. But the peptides that we're talking about here are peptides that act as chemical messengers. So your body makes a whole bunch of peptides, and it's constantly communicating between different parts of your body to say, to give it different functions, like bring healing cells to this area, or decrease inflammation, or help build more muscle. So these peptides are constantly talking. And in the last 10 years or so, we started to become interested in learning the language of what peptides are doing inside our body. And this actually came out of the bodybuilding community, where people started to understand how to replicate these peptides and turn up certain routes of communication. So, of course, what really was like the proof of concept that peptides work when you give them to people is Ozempic, because that is a GLP-1 agonist, and it's a peptide that increases the release of this GLP-1 hormone, which then increases insulin sensitivity, slows the transit of food through your gut, decreases cravings for less healthy foods. And it's the first drug in human history that has actually led to large amounts of weight loss. It's led to a lot of other things, but that was just kind of the proof of concept that giving back these chemical messengers can be really powerful. So, aside from the weight loss peptides, there are a number of peptides, some that reduce inflammation that can really help people with autoimmunity. There are peptides for body composition that are not weight loss peptides that help men and women put on muscle in a more healthy way. There are mitochondrial peptides, which are the energy production centers in our cells, and they help people create energy in a more healthy and sustainable way. There are brain peptides that help with focus and anxiety. There's sleep peptides. So this is kind of a new burgeoning science that we're starting to understand the language our body uses, and the fact that because we only lived till 45 for so long, those peptides were downregulated. The body tries to really conserve energy. So after our reproductive years, it kind of like shuts down the factory and says, we're closed for business. We're not going to make too much more of this because we've already done the important things. We've reproduced, and now we can die. But
so
we've
this
got a few other things on our list.
Right? So this really does tie into perimenopause and menopause.
100%. Yes, absolutely.
Okay. So when somebody comes to your clinic,
yeah,
say they're coming in, they're perimenopausal, menopausal, they're like, help, my body's wackadoo. What do you do?
Yeah. I mean, so I don't usually start with peptides. I will usually start with a lab evaluation and a long history, trying to understand the person, what they're struggling with, what's important to you, what your quality life is like right now, and what the biggest factors are that are sort of potentially impairing your ability to find joy in your life. And we do a lab evaluation to see where your hormones are, where you are, perhaps if you are a woman, where you are in the menopause transition, and if you need some hormonal support. If you're a man, men go through andropause, and now we're talking more about something called somatopause, which is more related to less growth hormone production. So men also go through this time period where they often will lose drive, sometimes become mood can change. They can become more cranky, depressive, and their hormones change as well. It's not as dramatic as ours. We are far more complicated creatures. But both men and women experience this. And I usually start by trying to support metabolic health, which that refers more to weight, body composition, how our body is using food for fuel. Because what I want is for you to be able to eat food and use that for fuel to kind of fuel your body and your organs, and then make sure that you have the right hormonal support. And then we kind of see where people are. And if there are still things that are not working the way they should, then we usually use some peptides short term to try to build up different processes in the body.
Okay, this is so fascinating to me. So, of course, I have a question.
Of course.
So, my question is, because this is also, you see it on the internet. I think we've had a previous guest. When a woman is wanting to check out her hormones, what should she be looking at on those labs? Like,
Yeah.
what do we need to ask? What are we, because we're hearing all this about, there really hasn't been enough research on menopause. We're just really having more conversations than we've ever had. And especially if you're going to a male doctor or somebody that doesn't specialize in this, are we making the mark?
Yeah. So I think it is challenging, but if women are still cycling, if you're still having a menstrual period, then checking your hormones somewhere around the 3rd week of your cycle, like in your luteal phase. So if day 1 is the first day of your period, day 21 is my favorite day to look at a woman's hormones, because your estrogen and progesterone is cyclical in your cycle. And I think we have the best knowledge of where those numbers should be around the 3rd week after you've ovulated. And that gives me an idea of where a woman is. So if you're still menstruating, it's around day 21. And the things that I would like to see first are 2 brain hormones called LH and FSH. So your pituitary gland in your brain produces those hormones, and those are messengers that talk to your ovaries and say, hey, spit out an egg. We want you to ovulate. And once your ovaries are going on strike in menopause, they don't want to put out any more eggs. They don't have any. We've done our job. We're done. Then the brain starts turning up that LH and FSH and saying, come on. You've got a little more. Let's keep going. And so when the FSH is greater than 20, then we know you're pretty much in menopause. And you'll see both of those numbers go up. So that just gives me, if a woman hasn't had a period in 2 years, I don't check that. I know you're in menopause. But if we're still in that, my period is really irregular or it's shortened, then those numbers give me an idea of how close we are for you to actually be through that transition. So that's one thing. And then I check estradiol, progesterone, and testosterone. And there are normal levels, which the lab will flag, and there's optimal levels. So, and this gets nuanced again, and you do best if you work with somebody who actually understands these things. But as we enter perimenopause, which is can be 10 years before we actually transition through menopause, and every woman feels that differently. Some women just sail through and they do great, while other women are like, I don't feel like myself, everything feels off, and they really struggle. So in perimenopause, the first hormone that goes down is progesterone. And and that goes down pretty steadily just over time. And progesterone is really important for sleep. So when we start losing the protection of progesterone, women start getting sleepless. It's also a calming hormone, so there's more irritability, and it's also anti-inflammatory. So a lot of women will develop autoimmune conditions or have more muscle and joint aches as they lose the protection of progesterone. And then in that perimenopause period, estrogen kind of goes on a wild ride where it goes low, it goes high. And in perimenopause, you may actually see higher levels of estrogen than you've ever seen during your regular reproductive years, but also really low ones. And that can be the real roller coaster where there's mood swings and irritability, and you're tired, and everything kind of hurts a little bit. Maybe you're having hot flashes, maybe night sweats, and we don't really see a steady low estrogen until you're really through that transition. But I think women can be supported with low dose estrogen patches pretty early on just to smooth out that ride a little bit. So I've talked a lot. There's one more hormone, which is testosterone, that's also really important in women, but we can get to that.
Well, and before we get to that, we were talking about this before the show, and I really wanted to make sure we said it on air because you were citing a study about when I can't remember, was it the 90s where they
Oh,
really
yeah.
kind of demonized hormones? Will you
Yes.
talk about that for our listeners?
Absolutely. So the Women's Health Initiative was a really big study where they looked at, they actually used mostly nurses, and they wanted to know the effects of hormone replacement therapy, which was pretty standard back then. And the women in that study were on synthetic hormones, which meant hormones that your body has never seen before. They actually used pregnant horses' urine for estrogen. They called it Premarin, which is pregnant mare's urine. And what they found was that really bad stuff happened when you take pregnant horses' urine. And it is
Such a
not
shocker, right?
so shocking, so surprising, you know? And they mostly started women who were like 15 years outside menopause, already had heart disease and a lot of other medical problems. On these synthetic hormones that the body's never seen before. And we saw heart disease go up and stroke risk go up, breast cancer risk go up. And the study was stopped prematurely, and women were just abruptly taken off their hormones. And we were told hormones are really bad for you. Now, there has been a huge uptick in interest in this recently because studies are starting to surface that bioidentical hormones, so hormones that are exactly what a woman's body makes, which are cheap, generic, and nobody had much incentive to promote for many years, are actually super healthy. And they prevent heart disease in women, and they prevent dementia, and they support bone health, and women's quality of life is really improved when we have healthy levels of these hormones. And again, it's the only reason why we go through menopause is because our body's adapted to have this shorter lifespan. And honestly, you know, I think in every other aspect of medicine, if somebody stops producing a hormone, we give it back. If you have hypothyroidism, you get thyroid. If you have type 1 diabetes and you don't make insulin, you get insulin. But for women, we stop making estrogen, we feel like crap, and they're like, you'll be okay. It'll pass.
That is so fascinating because I have never thought about it that way, but you're so true. And then they kind of talk us because I have not gone to get it checked to see do I need hormones or not. And I'm like, what is that story in me? Like, where did that come from? Did it come from the media? Did it come? I don't know. Like,
Right.
I don't,
Yeah.
why wouldn't I even ask about it? It's so
Right.
fascinating.
I think, yeah, and I think, you know, most doctors weren't trained to ask about it because and the findings of that study were actually redacted, officially redacted, and because there were some flaws in the study design as well. But there's a lot of advocates for this now, and we have a new body of research that shows that women do so much better when they do have hormonal support. If we're starting the hormones within 10 years of menopause, so the earlier you start, the better it is.
Okay.
We have to look at breast cancer risk. If you carry the BRCA gene or have a really extensive breast cancer history, sometimes estrogen is not the right thing for a woman. So again, this decision has to be made with your physician who understands this literature. But, you know, there's plenty of studies that women live longer than men, but most of the time our quality of life really declines way before men. But if you give us back the hormones that keep our brains young, keep our bones young, keep our bodies young, we can have really fruitful older years, you know?
Gosh, I love this so much. Okay, Sati, will you come off silent? Because I want to ask you a couple of questions.
Sure.
So do you have like, because we're about the same age, right? I think you might be a little bit younger than I am, but what message did you get about hormones and taking hormones and things like that?
It's just been in the dialogue with some of my peers. They're talking about their experiences with brain fog, for example, and And for me, it's a little curious because it does seem like they're just using that as an excuse. They're like, "Oh, I'm perimenopause. It's my brain. I just can't remember things." And I'm like, "Talk about you, Lindsay, my sister." But
Mhm.
I love you. But so for me, it's sort of like I feel like there's validity to it, and it sounds very. I mean, I hear what you're saying. But I'm just curious because I haven't heard a lot about it. I don't know much beyond just these buzzwords, and there hasn't been any additional substance behind it. So you've been really providing quite a lot, Dr. Gajer, that I'm like really appreciative of, just to hear. And I'm like, oh, I'm a bad sister, not bad, but I understand. I hear you. And then I've heard, on that previous episode on Women Connected in Wisdom, there was someone speaking about hormone replacement methods and how beneficial that was. So even hearing you say like the sooner you start, and it makes sense when you're talking about these other things. Like everyone, like thyroid seemed to be the big topic many moons ago. I'm sure it's still a big topic, but I feel like it was quite up there. Like now I'm hearing about perimenopause. So those are my thoughts.
It's so fascinating how we're impacted by media and like you said, the studies and one thing gets in our head about, oh, don't do that. And I'm just curious about which generations are impacted by that. I turn 56 on Monday, so I'm very solidly a Gen Xer, right?
Yeah.
And I'm just thinking because my girlfriends and I often don't talk about this.
Right.
It's so
Exactly.
fascinating. It's like,
Yeah.
okay.
Yeah. Yeah. I mean, I think, and also like some of these symptoms can be so subtle
Hmm.
where there's so many other things that you can blame in your life. It's a time in life where there's a lot of transitions, things are happening, there's a lot of demands, and it's easy to just say this is what getting older feels like, and a little bit of anxiety, I guess that's just normal, and I used to be able to lose weight easily, but now I just can't. And that's just normal. And yeah, I can't remember much. I don't feel as sharp, but nobody does and nobody sleeps well. But you know what? That's
It's
not
not true.
normal.
Yeah.
Not
Right?
true. And like I mean, I think I feel very grateful that I get to live in a time where like I get to make women feel so much better and like really have the lights come back on. And not everybody has this like you know things really feel bad, and I don't know what's going on. Some women do. For some women it's more subtle. um and I think women also just like are caretakers, and like
Mhm,
we sacrifice ourselves for other people, and
mhm,
this is a time in life, if for women who have children and careers, where maybe your kids are leaving the house and you've had this whole career. And a lot of women that I meet are like, um it's time to think about me. Well, what about me? Like, here I am,
mhm.
I've done all of this, and I feel so depleted. And, I think we used to think about this as this kind of midlife crisis. And I really love that we're thinking more about it as like, this is more of like a revolution now. Like
Mm.
you get to be you get to be the most authentic version of you, the most supported version of you. And like, you get to take the stage for this stage in your life.
Mm.
I love that.
The other thing that comes up for me when you say that is I think about like conversations I've had with my doctor, who at the time was a male, and he didn't hear me or didn't,
Mm-mm.
he's like, oh, you just need to lose weight. Okay,
Right.
well, great. I
Yeah.
didn't change the way I was eating. I didn't change my movement, but all of a sudden I've packed on 20 pounds and it's not going anywhere. Like, and you like that kind of, I'm just realizing as they're having this conversation, I wish you had been my doctor and
Yeah.
like, okay. So speaking of that, I know you have a clinic in Northern Virginia. How do
Mhm.
people access you? Like, do you do telehealth? Do they have to come to the clinic? How do they use you as a resource?
Yeah, absolutely. Um, so we do telehealth. There are some state um, restrictions. So we can do everything for anyone who's in DC, Virginia, or Maryland. And people who are outside those states, I do provide telehealth visits and usually work as a consultant alongside your doctor. So I can recommend what labs you should get and maybe what prescriptions to ask for, give you all the sort of lifestyle guidance and give you a clearer picture of where you're actually at and what the next step might be for you. There's just some restrictions around lab ordering in certain states outside this immediate area.
All right. And how close are you to the DC airport if somebody was going to fly in, just say from Atlanta, just asking for a friend?
Yeah, totally. Very close. Like
Okay.
30 minutes. Yeah.
Okay, good. And do you take insurance?
No, we don't take insurance. So
Okay.
that's the thing. That's part of the state that we're in with this type of medicine, where unfortunately insurers do not value time with patients. They do not value quality of life, and it is not possible. But we try to make it as cost efficient as possible, and don't try to make it outrageous.
And are you a oh, you got a question, Sati.
Well, just on that, do you accept the FSA or the HSA though?
Yes.
Okay,
Yes,
great.
we do.
There you go.
Yeah.
And are you a concierge doctor where you treat somebody all year, or are you like where you sign up, or do you pay as your visit?
No, it's just it's a cash pay model. So you just pay for your visit. You don't have to sign up for anything. The goal is to try to make it as accessible as possible for people. While keeping the lights on.
Right? Well, absolutely. Right. That's the thing about being in the helping profession, literally.
Yeah.
Like between insurance and all the things, it's like, okay, yes, I would love to do this for free. And the electric company does not accept my good wishes.
They don't. I've tried. I've been like, look, we're changing women's lives.
They're like, no,
cash only. Cash only.
I know we're about to go to wisdom in action, Christine. I did want to ask one other thing, and because Dr. Guy, I really appreciated when you were bringing up all of the additional variables that we as women experience, and that we're quick to, dismiss maybe some of these other root causes of what's actually occurring. My background, educational background, is in the behavioral sciences. And so I know a little bit beforehand, we were talking about What the Bleep Do We Know, that movie, which I know you haven't seen it yet, but I pulled up this little thing here because there's a rather extended scene where they kind of animate these peptides doing their little things, but it's all influenced by the person's thoughts and feelings. So this was saying, What the Bleep Do We Know discusses how peptides produced by the brain can cause bodily reactions to emotions, linking neuroscience to personal experiences and beliefs. This concept suggests that our thoughts and feelings can directly influence our physical state. So do you do anything like that when you're working with these women? Well, people, I guess, as well.
Yeah. I mean, I think that that's so on point. And I think that, with everything that we're talking about, our mental health, our emotional health, and particularly our nervous system influences our hormonal balance and the way everything else works. So yes, we definitely think about that realm. And I think that without a healthy nervous system, without actually intentionally thinking about how our nervous system is reacting to the world and how we're taking care of that, it's hard to find real balance. So I'm glad you brought that up, because it's something that we have control over. I think, again, it's like something you don't think about until it's gone. And we have the sympathetic and parasympathetic nervous system. The sympathetic is the fight or flight, which I don't want to take us down a rabbit hole, but fight or flight was actually studied in men. And more women will have this fawn or freeze response, where we don't realize that our nervous system is dysregulated, that's actually our fight or flight tends to be fawn or freeze, which is like, being extra helpful or just being kind of shut down. But anyway, the parasympathetic nervous system is the rest and digest, is the calm part of our nervous system. And I'm sure you both have talked about this at length, but there's a lot of things that we can do to turn on that parasympathetic nervous system, whether it's breath work or yoga or adult coloring books or a bath or just time with friends. So I think intentionally bringing the parasympathetic nervous system online is a really important part of physical wellness as well.
Oh, thank you. Thank you for that. I've never heard of fawn or freeze, but I got like my body reacted with that. I was like, oh my gosh. So thank
Yeah, I
you.
think most women get that. Yeah, where it's
Yeah.
like, again, studies done on men.
Right. Ooh, we could have a whole nother show on that, couldn't we? We could have a whole nother show. All right, before we close out, let's do our wisdom in action. So if we've been talking about all these incredible resources, and I feel like I could spend 2 more hours with you. You'd probably be like, Christine, enough. That's enough questions. But I really appreciate like you just answer down to earth answers about things that affect our everyday life because in our traditional model of medicine what would we get 5 minutes 10 minutes and sometimes I'm asking the questions, but I'm like, oh, you don't need to know that, or oh, that, and I'm like,
Right.
oh, yeah, you are no longer my doctor. But it's so thank you so much for that. But what we like to do as we go towards the end of a show is we like to check in with ourselves and just really, when you think about physical wellness for yourself, what are you doing for yourself? What's your wisdom in action this week?
Yeah, great question. So this has been a really busy season for me, or with kids and business, and I bought a new house recently. So like the busyness
Congrats.
is really intense. Thank you. So it's easy to feel like I can't find that time for myself, but I've been very conscious about still going to my yoga class and
Mhm.
doing my meditations once or twice a day, which is really helpful. And just like, and again, exactly what I'm talking about. Like, I
Mhm.
know I need to reset my nervous system to be useful to anybody else and to continue
Right.
to show up in life the way I want to. So those have been what I've been trying to keep up.
I love that.
Great.
What about you, Sati?
So many juicy things. I think what we like as you sip on your water, hashtag keep it fluid, keep it moving,
Mhm.
I heard an Ayurvedic doctor like video on YouTube saying that some of our issues, our challenges, right, are we're drying out because we're not
Mm.
moving. We're so sedentary. So keep all of the juices flowing. Get up, move, dance. Like the more, obviously, we have no problem with dancing, but do it more, right? Just give a little more
Right.
check on that and
I
watch
love
the
that
breath.
hashtag keep it fluid.
Keep it
That's
fluid,
awesome.
baby.
This week I'm traveling. I'm traveling to New York to go speak at a somatic dance conference and performance
Ooh.
festival and do an interplay performance up there. So every time I travel, I think about Dr. Sheila K. Collins and I do eccentrics. So that's going to be my hashtag this week is remember the eccentrics because
Mhm.
it's just where you're moving your fascia, you're stretching, you're doing all the things that like just make you feel good and it's gentle and I can do it anywhere. I don't have to be at a studio. I can do it in my hotel room or wherever I'm staying. So I think that's mine for this week. But
I love
y'all,
that.
this has been such a juicy conversation. I am so grateful. Any
Thank
last
you.
questions, Sati?
No, thank you, Dr. Geyer. This was great. You're not far from that DC airport. So when ATL starts showing up at your door, like,
Love it. Come on by. We'd love to have you.
thank you
Right.
so
And we
much.
will put all your information in our show notes so folks can reach you. If you find that study, send it to
I
me.
will.
We'll add it to the show notes. And I
Hmm.
just so appreciate your expertise and your willingness to share it with our audience
Yes.
because we haven't had this in depth of a conversation. And I know for me personally, it was valuable. So I
Good.
am hoping that it's valuable to our listeners too. But I'm like, ooh, I'm within 5 years. I got to go get some things checked. Thank you. Oh, that one more question. Shocker. Functional medicine doctor, OBGYN, or another doctor? Where do you
I
go?
would, yeah, I know, good question. But you would try to look for somebody who's a hormone specialist,
Okay.
or a menopause specialist, something of that nature that does hormone care or hormone optimization.
I love that. Thank
Yeah.
you so much.
Thank
Thank you.
No
We're
you.
so grateful
problem.
to be connected,
This
and
was
we hope
awesome.
we stay in touch.
Yeah.
Oh my gosh, so
Oh,
good.
so good. An hour goes so
It goes
fast.
so fast, and I'm sorry I asked so many
No,
questions.
well,
I was like, oh,
please
I got to
don't
give Sati
apologize.
some
They're
questions.
great questions. No, and I'm sure you were asking them because people needed to hear. Our listeners are curious. No one's
Right,
talking about this, and Dr. Gajer
right.
did such an amazing job, like you said, breaking it down, being simple, straightforward, honest, open, sincere, good advice. Go find y'all a hormone specialist, optimizationer, and
And you
get it
don't have
done.
to suffer. I really liked what she
No.
said is like, you don't, if your quality of life is going down, like go get that checked out. Like
Yeah.
it really give back. And the other thing that was so impactful for me is when she said, every other thing that goes down, we replace it except this
Yeah.
one. Like what?
Mhm. Yeah.
Ooh,
And
we
I
could
think
have a
you were
whole nother
saying
show about
before
this.
too, you were I know we're closing up, but it was this whole like, why didn't I ever think of that? And it's we don't know what we don't know, right?
That's
But
true.
now this is what Women Connected in Wisdom does. We bring on these expert guests, we have these conversations, and then, you're equipped to then go and find out more information. But if you never
Right.
knew, you never
Right.
knew. It's okay.
Right. I'm gonna have it. My mom's coming into town in 2 weeks. I can't wait to have
Yeah.
this conversation because I don't think she knows some of this stuff because like we just haven't really talked about it, and neither
Mhm.
of us had major symptoms, but we definitely have symptoms. I'll tell you one funny before we close out. We were on vacation, right? We hadn't been as a family in 5 years because my kids are grown. They're college, doing the whole thing, so it's hard to get us all together.
Yeah.
So it came up this weekend that they're pretty sure I was in menopause or perimenopause 5 years ago on the last trip because I did something that was like sharp or like they were like, oh, yeah, mom, like you were definitely, but
Yeah.
it made me laugh because I didn't feel like it was that bad. But evidently, to some people in my orbit, they were like, yeah, there was a little bit of a behavior change.
Well, and to your point earlier too, I do think these are conversations that the younger generations are having, right?
Right.
Like, I'll be 45 in September, but I haven't really heard this, and it's just kind of coming into my awareness through younger people that I'm around
Right.
that like it's common to them. So this was really valuable. I don't know, maybe we are experiencing things on this end too, and I don't know. It's just me and the two cats. They're not saying anything, so
Right.
I guess we're okay. But
They're like, hey, mom.
all right, there she go again, singing. Oh my gosh, run upstairs.
All right.
But this
Well,
was awesome,
friend,
Christine.
this
Thank
has been
you.
so delightful. Thank you
Yeah.
so much for co hosting with me today. And
Thank
I am just always grateful, grateful to be connected. And, we are because, how does that phrase go? I am because you are.
Mhm,
And Women
mhm.
Connected in Wisdom is because you are, my friend.
All right,
And
back
I
at your
just
reflection.
so grateful. All
Love
right.
you.
You want to say the magic words until next
All
time?
right. In the meantime, be well, be wise, be whole. We'll see you soon.
See you
Peace.
next week.